Guys, without further ado, let's go ahead and get started because I know Janet and Dr. Chatlos, you have a lot to discuss today. So I want to make sure that we have time and it's not rushed. So welcome everybody. This is First Responder Friday. I am super excited to be here and more excited that I love these people that are on and all the work that they're doing. And I'm talking about some trailblazing stuff, which is what we love on our First Responder Friday, Janet and Dr. Chatlos. So today we're going to kind of be like a part 2. If you joined last time, this is kind of an additional piece to that. You can go back and check out that recording as well. But we're going to talk today about, are you aware of religious and spiritual experiences in the mental health crisis, in addition to moral injury and community crisis care? I am super excited about this because we're starting to finally talk about moral injury in the first responder realm, but this is going to take it even a step further. And I'm going to...
And then what we call incarcerated in a hospital system, there was very little known, very little integration. So the second point, that it's being integrated into health and wellness, Dr. Chatlos will speak about. The third point, fourth on our agenda here, is we want to go deeper into when a spiritual experience turns into a crisis, into emergency. And what does that look like, sound like, feel like? But then how do we respond to it? And we're going to bring in one of our colleagues, Carlito, who's here to also comment and open up a conversation. The big one is, how do we prevent moral injury when something good gets locked up? And we'll close with next steps. So Dr. Chatlos, why don't you start to give us some of the basics for perspective?
Yeah, thank you, Janet. This slide actually has information from the Fetzer Institute in 2021. And what they did was, in America, ask questions. To what extent do you consider yourself a religious person? And to what extent do you consider yourself a spiritual person? And you can see what the results are. 70% of the population identify with religious or spiritual. And you can see the numbers are large. We often keep it in the background, and that even in mental health services, we keep it in the background. We don't talk about it, but so many people, so many of our patients actually come from and remain connected to some degree with a religious or spiritual background. Janet, you want to go to the next one? And this is what it looks like in probably the broadest perspective in America now. The date is 2014 because we have not had recent updated ones of this. Actually, we did have one a couple of years ago, and these figures are maybe within 1% of what it is currently. And you see that the predominant is Christian. And I guess to bring attention, not so much to the different denominations, but there are what we're calling religious nuns and unaffiliated. And we'll talk about that because even people without the religious background can still have what we identify as spiritual experiences. It's more real than we thought. And the work, as I mentioned, psychedelic research demonstrates that spiritual, and we'll talk about the word mystical because often they're used interchangeably depending on the situation, especially in research, that spiritual or this mystical opening to experience can be predictably promoted at this point. And the psychedelic research shows the neuroscientific basis. It shows some of the regions of the brain that we think are responsible for the opening to this spiritual experience. And over the last 10 years, there's been quite a bit of research, not so much clinical research, but statistically and looking at personality. There are 5 main factors to personality that seem to explain everything. However, the most recent research suggests that spirituality independently is a separate factor of personality. And this has only probably been identified 5 or 6 years ago and really isn't out there. And what some of the work I've been doing is recognizing how spirituality is actually organized in our experience. We're beginning to identify a specific language that allows us to intentionally move into this. I see a question. Can you define, I'm going to read it. Can you define spiritual versus religious? And Janet, that probably should be a slide we have at the beginning. When we're talking about religious, we're usually talking about something to do with beliefs and practices related to an institution or a specific tradition, where spirituality and spiritual experience is personal. Now, spirituality, spiritual experience may be associated with religion, but it may not be. That's why I said there can be religious nuns that, including atheists and agnostics, that can still have the capacity and have these spiritual experiences. Another term you might want to be aware of that's getting in the public and in the literature is what we would call religiousness or religiosity. These are people that may have religious or spiritual practices, but don't identify with a specific tradition. Someone that does yoga but isn't Hindu, someone that meditates but isn't Buddhist, someone that prays but doesn't necessarily identify with Christianity. So those are the different terms, and try to separate what they mean. So I'm sorry, we should have added that at the beginning. And then finally, as I've mentioned a couple of times, that psychiatric research now has literally demonstrated the ability to intentionally promote spiritual experience and spiritual awakening. And I might as well, since I've used that word awakening, awakening is what we use when someone has one of their first non-ordinary, what we would call spiritual experiences. And it is, I think, put on the next slide. I think I have the description. Yes. This is a description of what we're talking about. Now, I mentioned and talked about and defined spirituality. Mystical is often used interchangeably, and mystical has to do with the qualities and the characteristics that often come with that opening. And another term that we're beginning to connect with this is numinous. It's interesting. The word numinous comes from the word Latin numen, which was to nod, in terms of nodding to the divine. So let me just, as I've mentioned, we're talking about a non-ordinary experience. And it often has wonderful feelings, an ecstasy, a sense of newly gained knowledge, as if the reality, this knowledge is, it's not usual, it's not what I'm used to, but there's something important about it. It may get extreme. There may be body sensations, there may be perceptual alternations, there may even be hallucinations, but this is not schizophrenia. This is not a typical psychosis or bipolar disorder, but we'll talk about that. And there may even be unusual thoughts, to the degree even of delusions, with themes related to often mythology and maybe with religious traditions, and often also with just certain literature if people are readers. What's key is that with these unusual and often misperceived experiences, the person's thinking is still not severely disorganized. They can carry on a conversation. They can talk about what's happened before this experience, even if they can't quite understand what happened. There is an absence of the cognitive disabilities or deficits. You can carry on normal information gathering even in the middle of this type of experience. And something that's very important, usually with spiritual or religious experiences, it's very, very rare that they are associated with suicidal or homicidal ideation, which as first responders is our immediate concern. So this is what we mean by a spiritual or mystical experience. And these are just some of the characteristics. And advance the slide, because there's a message that this experience may progress. If someone doesn't quite understand what they're going through, it may become a crisis just out of confusion or disorientation. And it may even get, as I mentioned, with severe delusions, with hallucinations. It may get to the point where the person may start to panic because it's an emergency. It really may get frightening. And this is when these experiences often get misdiagnosed as either medical or mental disorders. And what I hope we don't get too caught up in the pathology and whatever, but the real importance of what Janet and I and this team are trying to do is that these are missed opportunities for true personal and spiritual growth and even transformation. So that it's not just let's avoid doing damage, let's help to identify what may be the beginning of a new day, a new direction for that person's life. Yes. Where the field is in terms of mental health, this is the DSM, the Diagnostic and Statistic Manual of Mental Disorders. And we asked the question, well, we see where SAMHSA includes spirituality. Well, where does mental health, where does psychiatry? And advance it one more. There's a very small piece in the back called additional conditions or problems that may be a focus of clinical attention. And specifically, advance to the next one. There's a specific V or a code called religious or spiritual problem. Now, one of the problems is we want to quickly diagnose, is this depression? Is this anxiety? Is this bipolar disorder? And pass on the information to the next treating professional. We are emphasizing that, okay, well, that may miss the main point. If this in any way is connected with a religious or spiritual experience, how do we communicate that to the next person that's going to be picking up the chart, or the next person we're going to be passing the patient or the client off to? So this is a chance to use religious or spiritual problem just in terms of communication, as well as, okay, yes, this is an additional condition that does need attention, has some connection with whatever the diagnosable mental disorder may be, if there is one. And I think there may be one more before you take over. Nope. Janet, I think that's my point. I'm good to go. You can take over and carry it into the moral injury.
Excellent. So I'm going to keep my story brief. One, because I shared it a little bit in the April 5th one, and two, come and watch the documentary and movie. You'll hear more detail. I had two spiritual emergencies, one in 1979 and one in 2005. They didn't start out as emergency. They started out as like an amazing Holy Spirit, 100% Christian-based encounter. And while I did understand it and I was not confused, I didn't know how to speak about it. And I didn't have anybody to speak with. So 79, I was 25. And so by holding it in, it eventually turned into an emergency. And part of our mission is to really raise awareness that this is real and we can talk about it, and, you know, it's not a mental illness. My second one happened in 2005, and that's like a 25-year span where I did not have mental illness diagnosis. I was highly successful in business. I was not required, or I didn't comply with taking any psychiatric meds. But kind of just a very simple thing is I had a business failure and I turned it around in a year. I'm up on Wall Street and I'm presenting how to make people aware of this. So in 2005, I was really called to start speaking. That all worked well. It was brand new for Wall Street investors to hear about this, to hear that it's in the DSM, to hear that medical doctors need to be trained, etc. The problem came when I went home and tried to explain this to my mother. And God bless her, you know, she was trained in the narrative that I guess non-ordinary experiences are mentally ill. So she kept it. And when she saw me be excited and inspired, she immediately went to a misdiagnosis from 25 years ago, called the police, and had me brought into a mental institution. That's the short piece. So 9 days after Wall Street, I'm in a mental institution talking to my Wall Street colleagues on what are we going to do about this. I want to go into the moral injury of this and actually ask the group, you know, what do you think is the moral injury of me being misdiagnosed, locked up at 25, and then again at 50, when it is a true spiritual experience? Dr. Chatlos has already diagnosed me. I never was bipolar. I'm not bipolar. More than likely, I will not be. And so my spiritual experience was suppressed, drugged, you know, and put in a box. And it's taken me 44 years to come out now and really do something about it. So I'm going to pull this slide off for a second and just see, do we have anybody who could comment? Because we really want to get into preventing moral injury. We want to probably help some of the people who have been traumatized. One more point. We have a team of somewhere between 50 and 100 around the world who have experienced what I did. Some of them were put in the hospital 4, 5, 6, 7 times. They are also MDs now, PhDs, therapists, advocates in Washington, teachers, trainers, coaches, very, very on mission to do good. But many of them suffered because as they tried to speak that they had a spiritual experience in the hospital, they were shut down and they were given more meds. So I'm going to open it up maybe first to Carlito. You know, how do we prevent, or what do you think is the moral injury on me and or our colleagues when it's shut down, and how do we prevent it? So I'll start with you and open it up.
Thanks, Janet. So by way of introduction, my name's Carlito, as she said. I serve as a crisis counselor for 2 organizations, Crisis Text Line and state of New Jersey, actually, as disaster response crisis counselor. So as a first responder, I think I can respond and say, my mindset or how to help prevent, my mindset when I see someone in crisis, and if we're talking to spiritual and something of a religious crisis, before it gets there, when I'm looking at the slides that Dr. Chatlos displayed, as well as paired with Janet's testimony, what I saw was something where prior to it becoming a disorganized thought and into crisis, I think the first point for all of us in prevention is listening ears. Okay, and that's really my crisis counseling hat on right now, but that's also applicable to anyone that of our citizenship, because in my own congregation, I'm training some folks too, just in my church, and out there, they're more aware now. They see some people, even if they're, you know, there's a case scenario where there's an individual just panicking because they were being yelled at it by a boss, and they're driving around in a truck and they're trying to deliver some product, and the person, you know, went off to the side and got out of the truck and was in panic, right? Just by being yelled at, cursed at, F-bombed, right? So she applied listening ears and knew the person's going through something, right? So the listening ears does this. It validates the emotion. So in Janet's testimony, like there's some sort of emotion that's bubbling up before it gets into disorganized thought. There is something there that we can identify with and just have listening ears, because what it does for that person is it validates them if you're listening to them, and it helps them understand, like, okay, there's something going on here. And with the case scenario of that person I just described, somebody who's helping out this truck driver, is putting a hand on the person on the back, just like, you're going through a lot now, are you okay, right? And the crisis counselor also wants, like, to deal with the emotion, but the goal they're trying to get, and however long this conversation takes, whether it's with me and crisis text line or disaster response, sometimes it's 45 to minutes to an hour. It's just getting to them calm. When you get to the calm, that's when you can actually insert and achieve calmness, and with that also empower them, empower the individual. So I guess prevention to me means listening ears first. It does validate that what the person is going through is something to them that is disjointed, dislocated, right? Emotional, right? In crisis, everyone has panic, anxiety, depression, et cetera, I'm not looking at the weeds of how it happened, or maybe I should bottle them up, right? Put them somewhere away, right? And I think first responders, you guys do a great job when you can get to a moment where you could say, hey, listen, before it gets to that, what can I do to help them, first of all, achieve this calm, and then empower them? And so the other thing we try to do too is make sure there are resources available that they can go to sort of carry out this process they need to get to. Like maybe Janet just needed to get to a process to continue with the calm and stay out of the disoriented in order to communicate what that spiritual emergency is. So, I mean, that's just part, like, sort of, how do I say it, Janet? Like, part of my mental health crisis alert system going on in my lens, right? But then also just, I think Dr. Olivia Johnson, she talks about this a lot too, is just having empathy, right? Just having empathy, but realizing if the person has emotion, let's actually divorce that through what they're going through, what we can see in the eyes from our sort of a naked eye test, and maybe if they're going through some sort of disjointed event, but that's just real. It's real to everyone what they're going through. It's valid what they're experiencing. Reach out and get to a calm, and then we could start empowering them into the process of getting to the next step. Now, that's how I wanted to start. Hopefully that was helpful.